diabetic blindness, how to prevent them. So I welcome all my guests, esteemed guests, and my mentors, Professor Natarajan, Professor NSD Raju, and my speakers, Professor Dr. Sabinath Patnaik, Dr. Sunil Kota, Dr. Kaplakant Panigai, Professor Narayan Misra, and above all, our President of Odisha State Ophthalmological Society, Professor G.S. Das. And I invite a lot of panelists I've invited, Professor Brajkishore Das. I will invite Dr. Sandhya Agrawal, Mrs. Sandhya Agrawal, Mrs. Ruby Khemani, and Mrs. Siba Chaudhary, Mrs. Sangeet Agrawal. So this webinar, as I said, it's a really some sort of discussion. So before we go to the speakers to start the presentations, I just play the message of our president of All India Ophthalmological Society, Professor Padma Shri Dr. Maipal Sesde. The message from Professor Maipal Sesde.
Conducting, checking out a plan.
Just
the number of cases of diabetes are on the rise, mainly because of the occupational changes that have happened, the lack of exercise and us becoming fit. That's one thing. The quality of the food has also fast food, and there is a lot of carbohydrates, fat, oils, etc. that is there. So the incidence, apart from possibly some genetic factors of diabetes, is definitely tending to increase, and we have people who will be talking about that. It's a known fact that given a long enough association with diabetes, people tend to have adverse effects on the eye of the individual, and that is often neglected, or diabetics even don't know that they can develop side-related complications of diabetic retinopathy. With that in mind, there was a core group that was formed.
Excuse me, sir. Excuse me, Subodhi, sir.
yeah.
Sir, we are unable to see your screen, sir. Please share screen again. Click on screen, sir. First option, sir.
Is it okay now?
Okay, sir. Now, okay, sir.
Okay.
Even in the most developed countries, it is the diabetic retinopathy is the leading cause of blindness. In India, though, it still remains cataract, but the number of patients who are coming up with
voice is not good.
So what is very important is that there is a steady awareness of the fact that an eye checkup is at regular intervals for all, and diabetic retinopathy, then early intervention and more frequent eye required. Diabetes and those who have diabetic retinopathy, or the core group for diabetic retinopathy has done a lot of entire group wherein we are have the number of these outreaches that are there, and as you all know that there is so much of work that is going on as for diabetic retinopathy, also for digital visualization of the retina with even with smartphones, etc. So I think there is going to be more and more emphasis that is going to be laid on early diagnosis of diabetic retinopathy. So with this, we have an expert panel and a lot of social workers and NGOs who are awareness that is being done. Thank you very much for participating in AIOS.
So,
Very much.
so now we have the message from our Honorary General Secretary, All India Ophthalmological Society, Dr. Namrata Sharma.
Diabetic World Diabetic Day, but everybody is there. For the public, would be answering the questions, physicians as well as diabetic retinopathy question. So it is also very important to highlight the fact that in the COVID times, because people have not got checked up, so it is important that they get checked up in terms of diabetic retinopathy, because the diabetic retinopathy progression and the macular edema progression would have occurred past months since March, if they have not already visited their so this is the first inaugural webinar in our endeavor of the All India Ophthalmological Society, and also Dr. Natarajan is the chairperson or chairman for the diabetic retinopathy task force. So this is the first of the inaugural webinars, and we are thankful to the sponsors for having agreed to this, and the entire task force diabetic retinopathy, so the All India Ophthalmological Society, which has been constituted by our president, Dr. Mayapal. So I welcome everybody to this public webinar, and we hope to continue like this again whole of the month of November.
Thank you, sir, for your nice welcome address. Now the webinar is open. We will start. So I request our professor, our president of Odisha State Ophthalmological Society, Professor Gunasagar Das, to give the welcome address. It is over to you, sir. Professor Gunasagar Das, President, Odisha State Ophthalmological Society.
Dear friends, good afternoon, everybody. Welcome to this land of Lord Jagannath, where everything is great, like Bada Thakura, Badadanda, Mahodadi, Mahaprasado, etc., etc. I welcome you all to this joint webinar organized by AIOS, OSOS, IMA on Jyot Se Jyot Jalao program. Here, Jyoti is knowledge of diabetes and diabetic retinopathy, which is a blinding disorder, but it can be prevented with certain measures. We have to go to the ground level to involve all the doctors, healthcare professionals, public in general, and NGO, and everybody to illuminate with this knowledge. I especially welcome Professor S. Natarajan, Dr. Nancy Raju, Dr. K. Panigrahi, Mr. Sabyasachi Mishra, Professor Bajakishore Das, Professor Narayana Mishra, and all others. Thank you.
Thank you, Professor J. Das, sir. Give a nice welcome address. So now we will start the program. First lecture is mine. I would like to share the screen, and I will just introduce to the program what you're planning for the month. Am I? Is it visible now? My slides are visible? Hello?
No,
Not
sir.
Can
It's
you hear
not,
me?
Not
it's not
visible.
visible.
Not visible.
Slides are not visible?
No,
No.
no, sir. Starting.
So maybe you can escape and then again start sharing the screen.
Okay.
Now it's video. Okay.
Now it's okay.
Sir.
No, sir.
please
You
go
share
to
the screen.
Now,
No. Sir,
Has
you
just shared screen sharing. Yes, you
close
start
the
then.
slide, open without this, and then you start sharing.
no, I was just doing that only. Now it's not visible.
No, we are seeing the blank screen. Dr. B.N.R. Subudhi has started screen sharing, that much.
Now,
Now you are seeing your computer. You just open
Yeah,
it.
you can open your
presentation. Just
open your PPT.
sorry, sir. Is it visible now?
No, sir.
Yes,
Yes.
yes. Full.
Yes.
Make it full. Make it full.
Okay.
Yes.
डलते हुए देखा है आपने? एकदम से नहीं डलता। पहले जरा सा ढलता है, फिर जरा और ऐसे करते करते रोशनी चली जाती है। यहाँ पर भी कुछ ऐसे ही है। धीरे धीरे रोशनी कम हो जाती है और हमें पता ही नहीं चलता। और ये सूरज ढल गया, वो भी नहीं है। इसे ढलने से बिल्कुल रोक सकते हैं। आंखों से धुंधलापन, किसी छोटी परेशानी को बड़ी
So, as you know, the diabetes also similar what Mr. Amitabh Bachchan said. It is asymptomatic in initial stage. Both either diabetes and also its complication like diabetic retinopathy, and until it leads to the advanced stage, then only it is detected, and at that time it's not, we are not able to do anything for that. So awareness is the key. This curing of this disease that's called diabetic blindness. So this World Diabetic Day is celebrated all over the world on 14th of November, just to raise the awareness among the public about the diabetes and its diabetic complications. So, but we are concerned, we often is concerned by the diabetic blindness, and as you know, which is about 20% of the all diabetics. And if you know the fact, recently it has been published in the newspapers, it has come that the recovered patients, they are likely to suffer from diabetes. Probably the viruses has something to do with the damaging the pancreas. So, in view of this grave conditions, and India being the diabetic capital of the world, a public awareness is highly essential. So that's why we have two societies. One is IMA PDB society, a branch of, you can say, a part of IMA, and also AIOS DR task force. This is also part of All India Society. And this IMA PDB program has the two approaches. First is to create awareness in the society about the diabetic blindness and screen all diabetics for diabetic retinopathy so that we can take adequate action in the early stage so that we can prevent diabetic blindness. And of course, those detected diabetic patients, we must treat them. Otherwise, no use. And that is one society. And other one is the AIOS DR Screening Task Force. It's again a subset part of All India Society where few members with the chairman, our Professor Natarajan. And the aim of this society is to screen all diabetes for early detection of diabetic retinopathy and prevent diabetic blindness, giving treatment. So both these programs are pointing towards prevention of diabetic blindness and detection of diabetic retinopathy. There are various ways to create awareness. There are a lot of programs like walkathon, marathon, cycle rally, public meetings, awareness message, Doordarshan, All India radio, TV channels, newspapers, and nationwide awareness campaign at all IMA local benches during the World Diabetes Day. But however, because of this COVID, it's not possible to hold all these meetings because of restrictions and because of increased incidence of growing incidence of COVID during this period. So we have to conduct some webinars, and also we have to depend upon the Doordarshan and All India Radio to spread our message of prevention of diabetic blindness. And this year, the World Diabetes Day theme is nurses make the difference. As you know, the primary care in the treatment of any disease is the paramedics, mostly the nurses. The nurses play major role in preventing or treating the disease. So we must put them together in any program so that our programs can be successful. So this year, nurses have been pulled to part of this program, this World Diabetes campaign, so that which focus on promoting the role of nurses in the prevention and management of diabetes and its complications. This All India Society plan, we plan for the next whole month, from 1st to November to 30th November, with a celebration of World Diabetes Day on 14th November, wherever possible, we will conduct screening camps with strictly following the guidelines by the government of India and government of Odisha or government of state governments, you can say. And daily public webinars from 4 p.m. to 4:45 or 5 p.m. from 1st to 30th November, creating awareness in the society, inviting all the NGOs and public. And diabetic retinopathy eye screening, pre-screening of all diabetics under the COVID restriction guidelines. Public participation in the program is highly essential in these programs. And IMA activities, Indian Medical Association having a large number of branches and more number of members. We also planned in a repeating manner. We celebrate how we organize programs from November 14 to December 14, 2020. That is whole month we observe this program. And all the outline, all the programs which observe on the first day, that is 14 November, it will continue every day till the 14 December. We will be conducting CMEs, displaying diabetes awareness posters, and press conferences, public media publicity, television talks, radio talks on the subject, and holding press conferences. And screen all diabetics wherever possible with all the guidelines by the government of India. As you know, the theme of World Diabetes Day, as I told you, must be underlined and emphasized on their role in prevention of diabetic blindness. And whatever the data we collect from all the screening camps must be transferred, compiled and transferred to the headquarters and passed on to the government of India to plan for this program. And that's why we request full support and help from all voluntary organizations like NGOs, like Lions Club, Rotary Club, all those clubs. And that's why we invited all the chief presidents, secretaries of all the clubs to this program. Together we'll make this event a very successful national program. That is our aim of these two programs and two projects like IMA PD project and the AIOS task force. Recently, COVID restrictions, two successful camps have been held, one at Darjeeling and one at Bargarh, Odisha. So with these few words, I welcome you all with this message to all my friends sitting over this panel and also outside the panel, the viewers. I want to emphasize the message that diabetes is a leading cause of blindness. Diabetic blindness is preventable. Diabetic blindness is irreversible. So get your eyes examined for diabetic eye disease prevention. As my president has said, Jot Jalao. So little lighting, I think we can bring light to all diabetic blinds in our country. Thank you very much. So with this message, now I invite my next speaker, Dr. Sunil Kota. Before that, I want to announce that today I'm really lucky to get one of the signed actor, a public figure, Mr. Sabyasachi Mishra, a great person who has agreed to be the brand ambassador for our program today and subsequently also to give a public message. He will be joining shortly, maybe after one of the two lectures. So I welcome him to this webinar and to give a strong message to the public, because he's a very good a public sympathizer, I would say that. There are a lot of public service that is, in addition to his activities as a cinema actor. So now I invite Dr. Sunil Kota, a great endocrinologist of our country, I would say that, not the state, country, who is the very famous, not only profession, in academics also, but a lot of publications which credit. So now Sunil, please.
Yeah. So in order to keep the streaming hassle-free, I would be just stopping my video share. So first of all, thank you so much, Professor BNR Subudhi sir, our esteemed teacher. And I can see many of my teachers are always already there. And we have people from different fora who have joined us today. So I will be talking briefly for about 4 to 5 minutes about diabetic eye disease. It has been amply emphasized by all the panelists, the President sir and BNR Subudhi sir and everyone, that yes, it is a very common cause of impairment of vision. It is one of the very important cause of blindness. It is preventable, but once it sets in, it becomes irreversible. So there are two problems that the diabetes is going to have its impact on the eye. In the short term, yes, the high glucose can change the fluid levels or cause swelling in the tissue of the eyes. So there can be a blurred vision, and whenever there is a sudden vision problem, then all of a sudden we sometimes ascribe it to very high blood sugars, and at the same time, whenever the glucose remains high for a pretty prolonged period of time, we are generally worried for its effect on the tiny blood vessels in the back of your eyes. That is, that sometimes can start much before the diagnosis of actual diabetes, which we all call as pre-diabetes. So what happens is sometimes the damaged blood vessels may leak fluid and cause swelling. Sometimes new weak blood vessels may also begin to grow. Some bleed into the middle of your eye, giving to scarring, or can sometimes dangerously high pressure also can be created inside your eyes. And as Nageswar sir was rightly telling us, most of the times there are no symptoms of diabetic eye disease, but sometimes there can be presentation with symptoms like blurry vision, or sometimes people describe it as a wavy vision. Then hello, yeah, so it can be associated with vision loss or patches of dark areas. Sometimes color vision can also be affected. Sometimes what we call as floaters, they can appear as spots or dark strings passing in front of your eyes. Then that can be in the form of flashes of light as well. But then most of the times it is not associated with symptoms. That's what is the takeaway point from the entire gamut of things that is going to be presented in front of you. And a number of conditions get aggravated when you have diabetes. I'm not going to talk to you about the superficial conditions, but one thing that is very important cause of blindness, that is the diabetic retinopathy. We all understand retina is the organ at the back of your eye, which is also known as this screen, which senses light and turns it into signals so that we can actually have a interpretation of these signals, whatever is coming from your eyes. So as I've already stated, in initial stages, the blood vessels can get weak, they can bulge, or sometimes they can leak into the retina. Or in the advanced stages, when we call medically as the proliferative diabetic retinopathy, we see sometimes there is a formation of new blood vessels which can proliferate, which can bleed into, and they can give rise to all sort of problem. And there is a sensitive part of the retina which is called as macula. It is the part of your retina that probably you need for your day-to-day chores like reading, driving, and seeing faces. And whenever there is oozing of liquid and the liquid or the fluid gets deposited in and around the macula, then the sharpest part of your vision gets damaged, and that can give rise to a state called diabetic macular edema. And by this time, we all people from Ganjam are very much aware of what exactly is glaucoma, thanks to the whirlwind activities on the part of Nageswar sir. Yes, the diabetes can also give rise to increased formation of glaucoma, and there can be increase in cataract formation as well. So it is very important to screen your eyes very regularly. And it is always, people ask, doctor, I do not have any symptoms, should I go for any testing? Yes, the answer again lies with what Professor BNR Subudhi sir has already told us. It does not come to the fore with frank presentation with symptoms. It has to be picked up early so that it cannot progress. And lot many times people have a confusion that yes, my eyes were checked, my the refractive error, my powers were checked, but that is not that will not amount to a wholesome diabetic eye evaluation. So yes, we need to test your vision, we need to measure the pressure in our eyes, but again, a dilated fundus examination is something which sir has been doing it over the years for so many people around across the Ganjam. I think most of the people are aware what it stands for. So that again is important. And when exactly do we need it? Especially in the type 1 diabetics, those are not very common, which constitute to less than 5% of the entire diabetic population. Annual eye examinations should start within 5 years of diagnosis, or the patient reaches puberty, whichever is earlier. And for type 2 diabetics, as I've already stated, much before the onset of frank diabetes, the eye changes can set in. So there is a recommendation that the type 2 diabetics have to go for annual eye examination right at the time of diagnosis, and then onwards once in a year at least. And depending on the depth of problem that you have, you may need to get it checked more often. And again, if a patient is already having diabetes and is planning for pregnancy, either you are type 1 or type 2, you have to get your eye examination done before pregnancy or within the first 3 months. And again, lastly, I would like to conclude by stating that 3 major parameters of prevention of eye disease, we all have been focusing on that. The ABC. A stands for A1C, which is a marker of your blood glucose control. B stands for your blood pressure control. C stands for your cholesterol control. And obviously, we all understand that smoking is a very big detrimental factor for diabetic eye disease. So you have to keep that under check. So I wish the program a great success. And thank you so much, Nageshwar sir, for giving me this wonderful opportunity of interacting with all of you people. Thank you. Namaste.
Thank you, Dr. Sunil, giving a elaborate discussion about the ophthalmology rather than the diabetic disease. So I think uncontrolled diabetes is the major cause for this development of all these complications what you have told. So now I invite our next speaker, Dr. Sabyasachi Patnaik. I think he's well known not only in Odisha, outside Odisha also. At present, he is the additional director of Health Services, Government of Odisha, and placed at Rourkela. And he is also the secretary of Odisha State Ophthalmological Society. I invite him to deliver his lecture. And why the diabetic leads to diabetes blindness. As already Dr. Sunil Kota has told the mechanism, but still something has to be told. So Dr. Patnaik will say in detail about that. So we can use our local language too. Not only English, we can use Hindi also. We can use Odia also at times. So that there are people here and that they are public. So sometimes because these people, sometimes they may not understand some technical terms. So I request the speakers to speak something in the local language too. It's over to Dr. Sabyasachi Patnaik.
Thank you, sir. Thank you very much for the nice introduction. At the outset, I must express my gratitude to you, respected Professor G.S. Das sir, the President of OSOS, respected Kamala sir, President IMA, and the other panelists and dignitaries present in this webinar. Now, as sir has already explained, Dr. Sunil has explained many things about diabetic eye changes, the mechanism. So he has made my job very simple. So to start with, we know that the prevalence of diabetes is increasing world over. So also in our country and also in our state. Now, every diabetic is a potential candidate for loss of vision due to diabetic retinopathy. We have to understand this very clearly. Many times people feel that I have controlled diabetes, I am doing regular morning walk, exercise and other things. My sugar level is well controlled. I can able to see very clearly. So that means I am not going to be affected. Maybe. But there are situations in which this normal looking fundus, as has already been described by Dr. Sunil, the central part is the macula, the most sensitive part, which is responsible for our clear vision, becomes damaged because of the diabetes. These are the exudates, AIOS exudates deposited because of the edema and subsequently the deposition of hard exudates in the center. And this is known as the macular edema. And many times there occurs hemorrhage inside the eye because of the proliferative retinopathy. So these are the two reasons why there is decreased in vision in diabetes. One is macular edema, most commonly occurs in type 2 diabetics, and the hemorrhages, that is common in type 1 diabetics. So unless this happens, there is no chance of decrease of vision. So many times I think, does diabetes cause blindness? Because blindness doesn't occur overnight. It is not that suddenly somebody becomes blind. Suddenly he appreciates or he knows that he has become blind or his vision has gone down. It doesn't mean that diabetes did it overnight. So it progresses in stages. Initially there will be few hemorrhages, little bit of exudate. So we call it at mild stage. Then it progresses to moderate, then severe, very severe, and ultimately there can be macular edema. So a disease which is giving us a time of 10 to 15 years to rectify yourself, to take necessary steps. So I am the last person to say that this is a blinding disease. And these are the proliferative complications. As long as the changes are confined to the retina, it is known as non-proliferative. When the blood vessels progress beyond retina, then it is known as a proliferative retinopathy. These new vessels are created in order to supply oxygen to the retina, because this is a response by the nature to provide ample amount of oxygen to the retina. Retina needs lot of oxygen in the body. It's a highly metabolic tissue in the body. So that's why this is a response. But these vessels are very, very fragile. So at any point of time, they can bleed and they can rupture. And suddenly a person feels that his vision has gone down or there is something blocking his vision. So this leads to the blindness or decreased in vision. And this is how the diabetic person with blood inside will see the normal background, which is very clear. Now you will see it or appreciate it as patchy as long as it is completely not obstructed. So again, does diabetes cause blindness or the negligence of it? So certainly for a quite long time, I used to say patients that they have neglected their diabetes. But rather, of late I realized it is not the patient who neglected. He is a part of that. But how can a person know that he has diabetes causing this much of changes inside his eyes? Unless we tell him, unless we aware him, unless the government or the system takes care of him, he cannot know that he is having all the changes from mild to moderate, severe and proliferative changes inside his eye. So that is why it is very important that every diabetic should have a regular eye checkup. And we know 90% of diabetic eye diseases can be prevented simply by treatment of diabetes, controlling systemic risk factor like anemia and blood pressure, and proper regular eye examination. This is very important, and the very purpose of having these awareness meetings is to emphasize these three things. If you do these three things, if you can stick to this, if you can advise our diabetics to have these three things, then there is less chance of going into blindness. So we have to remember, every diabetic is a potential candidate for retinopathy and blindness. Diabetic retinopathy is symptomless till considerable length of time. It gives a lot of time for us to take care. So all diabetics need annual fundus examination. Only 20% of them need active intervention by ophthalmologist. Otherwise, by general physician or general ophthalmologist can be taken care. So our goal is prevention of development and progression of diabetic retinopathy leading to blindness. Ultimately, a diabetic blindness-free India, in particular Odisha also. As because if every state will become diabetic blindness-free, the entire country will be diabetic blindness-free. So our government has initiated an ambitious program in the name of Sunetra for taking care of eyes of the people. of the 4 crore people of the state. And this diabetic retinopathy is also an integral part. When I was a part of that, I developed this mobile app through which the diabetics could be registered themselves and also take appointment in any institutions of their choice or preference. Somehow that has become stopped now, but we have to again take steps to initiate this process. Unless digitalization is done, it is very difficult to take care of diabetics. It is very difficult to know who is coming or who is taking regular follow-up or who is following the protocol regularly or not, and what is the status of the retina of those persons. So we also emphasize the need for a national program for prevention of diabetic blindness, maybe under NCD or NPC. This is the need of the hour. And this should have the objective of having awareness creation and provision of uniform, standardized and affordable or free facilities for care of diabetics for control of blood sugar, which is very important. Unless the blood sugar remains controlled, there is no way we can prevent diabetic retinopathy or blindness. And we have to prepare a diabetic registry. We can start in the state also. If we can, as IMAPDB, I have also explained in one of the meeting and discussed that we can start under IMAPDB also a diabetes registry in the state, and that can also be replicated in other states. And regular fundus evaluation and capture of fundus photograph at CSC level is very important, because it is not always possible for everybody residing in village areas or block areas to come to medical college or district headquarters for these things. So we can have a provision of taking fundus photograph by digital cameras at CSC's level, and we can be graded at grading centers. And artificial intelligence and digital health has proved to be very effective in controlling diabetic retinopathy related blindness. And there has to be affordable treatment for all also for retinopathy. Many times we detect them, but the treatment becomes unbearable or unaffordable by the part of the patient. So we have to provide affordable treatment at institutions which is convenient for the public also. So we have to put a team approach. The public, the physician, diabetologist, and other persons of healthcare professionals have to work together. Otherwise, it is not possible to tackle the problem like this, a gigantic problem like diabetic retinopathy and diabetic blindness, which is going to increase further in coming years. So as Helen Keller has rightly said, alone we can do so little, but together we can do so much. So the purpose of this awareness meeting is to at least pledge that we will all work together to tackle this problem. Thank you very much. Thanks for giving me this opportunity to interact with all of you. Thank you, sir. Sir, unmute, sir. You are muted. Sir, unmute yourself, sir. Subudhi, sir.
Thank you, Dr. Patnaik, giving the wide mechanism of how blindness can occur because of our negligence. So your definitely your plans and the programs definitely will enhance our programs in the future to prevent this diabetic blindness in our state, in all over the country. This is a government, I mean, IMA project and all of the society projects. So everything will be to all over the country. So with this, now I invite our next speaker, Professor S. Natarajan, Padma Shri Professor Natarajan. He is a retina surgeon practicing at Mumbai, having his own setup at Aditya Jyot Eye Hospital. Besides his professional career, he does a lot of social work, and he does a lot of diabetes screening camps in Dharavi, the slum. And he had the record, Guinness Book of Record of holding 5,000 screenings in one day at Dharavi, the slum. So, and at present, he is the chairman of our All India Society Diabetic Retinopathy Screening Task Force. He was the past president of All India Society also. And he will describe how and why the retina screen is important in all diabetics. So at least periodically, all diabetics must screen their eyes by different methods. So it's over to Dr. Natarajan, sir. Dr. Natarajan, sir.
Has he joined?
So I think he's showing, but maybe he's engaged somewhere. So anyhow, he will be joining with us if he's not joined there. So now we will switch over.
Aditya
to
Jot
next
is there. I think.
is there? There,
Aditya
Aditya
Jyoti
Jyoti is
is
there.
there.
but no video, no. We are not.
Probably because he I think he always have at least 4 to 5 seminars every day, webinars.
Yeah, he
So
must
maybe busy with one webinar. I think he will finish up the webinar, will join with us. In the meantime, we will have another speaker again, past president of All India Ophthalmological Society and our chairman of IIB PDP program, Dr. NSD Raju from Kerala. So I welcome sir, Dr. NSD Raju sir. Are you there?
Yeah, he's there, sir.
Yes, sir.
Please
So,
unmute.
yeah,
Sir, unmute.
sir, unmute and start your
Yes, thank you. Thank you,
presentation.
Dr. Subudhi.
So I will share your screen.
Yeah, you can. Thank you, Dr. Subudhi, for inviting me to be part of this awareness program, which has been organized in collaboration with the IMA and also the Indian Medical Association, IMA, and All India Ophthalmological Society. So we have been collaborating with the IMA has been collaborating with the prevention of diabetic blindness program for the last so many years, and actually we'll just go through and see how we have been associating ourselves with the All India Ophthalmological Society also in our endeavors to fight against the increasing menace of diabetic blindness in the country. Can you just share my screen, Dr. Subudhi? Do you have my slides with you? Dr. Subudhi, can you?
Just hold on, I'm sharing, I'm trying.
Right. Okay.
Please continue.
Good. Yeah. So we have been myself, Subudhi, all have been together in fighting against this increasing menace of diabetes and diabetic blindness in India. You have probably in your mind the voluminous, the volume of the diabetic population in India is quite high. It's more than it is nearing 80 million people, and it is second only to the China, where they have a maximum number of diabetes. So we are slowly inching towards occupying the position of the diabetic capital of the world. So you know that how serious and how important this health issue in India. So all of us will have to join hands together and fight and find out how exactly we can prevent this diabetes, and of course the diabetic complications. The most dangerous one is perhaps the development of diabetic retinopathy in a sizable population. So if you have 70 million people with diabetes, about 20 to 25% may be having the diabetic retinopathy, which Dr. Patnaik has so elaborately and nicely explained, may be harboring that disease, but they might probably not know that they have the disease, because the affection of vision, the defective vision might come only later. You may be harboring the disease, but at the same time, you may not have any symptoms. So you probably think that your eyes are okay. I have no problem with my eyes. Why should I then go and get my eyes examined by a doctor? That is not so, because even in a fairly advanced state of retinopathy, you might enjoy a good vision. So that such complacency is really doing harm to your health, because even if you don't have any symptoms, it is necessary to have a regular checkup of eye, which Dr. Patnaik also has pointed out, and earlier speakers also, how important it is to have a regular and periodic eye examination almost every year. Now, probably with the COVID season and the corona infections spreading at a rapid rate, it may not be possible for all of us to do that yearly basis, but at least in 1 to 2 years, all diabetics should have a thorough examination of that by a competent specialist. But all diabetes, once it is diagnosed, especially the type 2 diabetes, they should have a evaluation of their. Dr. Subudhi, my slides are not coming or what?
It's coming now.
You have not shared it, no?
I said it. Yeah, there is a problem.
No, it's not coming.
Okay, no problem. But we can continue the talk, maybe.
Continue.
Okay, right. So we were talking about why it is important to have even normal diabetics without any visual symptoms should undergo evaluation of their eye, and this has to be repeated. Once it is done, and you find that there is no retinopathy and no risk, then that is not the end of it. But it has to be an ongoing thing. You have to have your eyes checked up every year, or at least once in 2 years. So that is one thing. So there are certain basic things with the public should be aware. One thing is that diabetes is a leading cause of blindness. Many people do not know that diabetes causes blindness. So this information itself is important. Otherwise, they will never think that my eyesight could be lost because of diabetes. The second important thing is that, as I said, a regular checkup of your eyes once in a year. That is the second one. The third important thing is that you must know that diabetic blindness is irreversible. Once your eyes have lost vision because of diabetic complications, any number of surgeries and other things are not able to. Once it is lost for good. You have yes. So these things that we have already examined, and these are the methodology, how we have been doing it in association with the All India Ophthalmological Society. You can see the film stars there, no? She is, what is her name? Karishma Kapoor. Yes, she and Malhotra, they are all film stars, and they also help us in promoting the awareness messages. We start these awareness campaigns in all the states. They have launched the PDB program in almost all the, you can see the Assam, you can see Meghalaya, that is a governor inaugurating. So myself, Subudhi and all, Dr. Panigrahi, all have been traveling from one corner to another to propagate this idea of what diabetes is, how it is going to damage your eyes. And we have a special committees. You can see even our AIOS president, Dr. Ajit Babu is there, and representative from America, Dr. V.K. Raju. So these periodic meeting of the steering committee have been going on since 2015. And here, this is, I think it's some Chhattisgarh inaugural function. So all part of, even in the Northeast frontier regions, we have been doing. And we do the screening camps, as you can see, with the, you see the AIOS. So we have been associating ourselves with the AIOS also. So together, as he said, as Helen Keller said, alone, you don't achieve great things, but together you could go higher and higher and achieve greater things. And that is what we have demonstrated. With our combination, we have formed a very strong bonding between the AIOS and the All India Ophthalmological Society, and we are marching forward, and success will be ours. These are the diabetic app. We have a Facebook page. There we give all the information. So whatever opportunities and avenues are available, take full advantage of that, so that this awareness spreads. It is not only creating the awareness, but spreading the awareness is also important. Quite a sizable number of patients do not know that these complications can occur, how we can prevent it and things like that. They must know that it's an irreversible thing, but they must also know that it is preventable. It is a preventable form of blindness. That is the most important information. They also should be aware. Then only they will subject themselves to periodic examination and then prevent. The fourth important thing is that the adequate and tight control of diabetes is an important attribute for preventing the complications, especially the diabetic retinopathy. So a good control of diabetes, which is also should be ensured so that you don't develop the complications like retinopathy, neuropathy, nephropathy, and all sorts, and especially the diabetic retinopathy, which eventually, if not treated and recognized early and treated, might end up in irreversible blindness. So that is a very sad state of affairs. I think that these sort of meetings and these sort of webinars with public involvement is an important thing. And I must congratulate Dr. Subudhi, Dr. Natarajan and all for creating this awareness in the public also. There is no use telling this thing to the medical profession at large. So they already know these things, but the public should be aware of it. And this is a great step you have taken. And we are marching forward. And with all your help and support, we will be able to control diabetes. We will be able to control the complications of diabetes. And ultimately, we can prevent the blindness that results. We can control and at least delay the onset of the complications. So it's a great thing. So let us all fight together and fight against this scourge, this menace of diabetic blindness, which is preventable. And certainly we will prevent it. Thank you for your patient hearing. Thank you.
Thank you, sir. Thank you, sir. He's my chairman of this IMA PDB program. In the last 5 years, we had a lot of activities. And in coming years also, will be a lot of activities to control and screen diabetes and diabetic blindness in our country and reduce the diabetic blindness, if not complete cure of diabetes, diabetic blindness. So now I request our next speaker, Dr. Kamalakanta Panigrai, who is the president of Indian Medical Association, a very good public speaker and public organizer, and does a lot of programs all over the country, and a famous urologist of Odisha and the country. So I request him to come and say a few words how this our program will be successful, not only in our state, all over the country, to reduce the diabetes and diabetic blindness. It is over to Dr. Kamalakanta Panigrai, sir.
Good evening, sir. I welcome everybody to this seminar. Thank you, Dr. Professor Subudhi, for inviting me, because me, Dr. Raju, Dr. Subudhi are associated with this program since last 5-6 years. Actually, the IMA AIOS has a joint program. This is am I audible, sir? Am I audible?
Yes, yes.
Okay, thank you, sir. The IMA started this project actually 6 years back with Indian Ophthalmological Society, and IMA had a flagship program. This is going on regularly throughout India. And Odisha, we launched the first time in India. Odisha was the first state to launch this program with the brand ambassador of Siddhant Mahapatra, our ex-MP and film star. We had a very good launching program at Bhubaneswar. Dr. Raju was witnessed and national officers came. Dr. Subudhi was the key person in that, and I was the honorary state secretary at that time. So this 5-6 years has gone. We have moved from pillar to post to make the program awareness to the public, and we have been associated with so many organizations like Tata Consultancy, Rotary, Lion, and other associations. We have been doing rural camps also in different parts of the state. And I think more than me, Dr. Subudhi has moved from many areas of all the state branches. He has moved so many branches. I was there for a few branches, but unfortunately, because of the corona pandemic, we could not visit this last 1 year. Totally, it is becoming zero. Though there is no physical meetings anywhere in the state, though I am the state president, unfortunate that I am not able to go. And Dr. Sudhi, we had a very big plan, but everything failed. But we are doing this virtual meetings throughout the states, and Dr. Sudhi is doing regular because he is the national coordinator nominated from Odisha state and accepted as the national headquarter. He is the national coordinator, and Dr. Raju is the chairman. So I hope this will continue. I am always there to help. IMA is the partner of this program, and hope we will prosper and we will be continuing our program in propagating the awareness of the prevention of diabetic blindness. I thought I will be speaking only, otherwise I would arrange a few slides, how we have done in Odisha. So many programs we have done. And Dr. Subudhi, myself, Raju, Dr. Raju came several times. So thank you very much, sir. I wish the program continue and a successful program in future. Thank you very much.
Thank you, Dr. Kamala Panigai. Now, Dr. Natarajan sir, are you there? Dr. Natarajan sir, have you joined? Okay.
We are seeing his flyer only.
I think he, somewhere is busy.
Can you call him, sir? Just.
Mr. Sabyasachi Mishra, our sign actor, is about to join. He said he will be joining within 5 minutes. So I think now, may I request all to show their videos so that we can have a panel discussion. Sir, now I will hand over the mic to another great personality. I would say that Professor Dr. Narayan Mishra, our ex-Rotary Governor of districts. I don't know the number, but he was the past. Yeah, he's a very active person at present. In the COVID era, I think every day he's enjoying. I would say that every day he's enjoying 2 or 3 webinars and also a lot of TV programs.
We are enjoying him, sir. We are enjoying him.
He's enjoying definitely. So a public spokesman person on a lot of health issues in our state and in our country also. He has got a lot of publications to credit. He was so many societies, the president, secretary. I want to enumerate them. So I invite him, sir. So now I think your time in between, if Mr. Sabyasachi Mishra, the film star, joins with us, he will give as a 5-minute talk. We will stop for that, but otherwise we will continue. Now it's some sort of a public discussion, a lot of public personality, lot of chiefs of different clubs of our state and the country are with us, and the speakers are also available. So we can have a wide discussion about the program, what we have discussed in the past half an hour, 45 minutes. Sir, it is over to you, sir. You have to make it interesting because you are the very interesting person I've ever seen, sir. Sir.
Thank you, BNR. Thank you very much for inviting me. I welcome all the speakers, panelists, and the audience. And I have learned a lot within this short span, I can say, Dr. Subudhi. As Dr. Raju was telling, our India is going to be the capital of diabetes very soon, and diabetic can damage any organ of the body, including the eye. And we have now at length discussed little bit in general about this diabetic retinopathy just before the World Diabetic Day. We can say this is the eve of World Diabetic Day. So thank you very much. Only for the audience, I can just ask.
Before we start the discussion, I think Mr. Sabyasachi Mishra has joined with us. So welcome, Mr. Babu. I think he has joined. Let us hear from him. Then before we move on to the panel discussion. So
okay, we will welcome him. We will welcome him.
Please unmute yourself.
Welcome, Sabyasachi Babu.
नमस्कार मु समस्त को नमस्कार जनाऊँची मु टिके विलंब हो गला कना गोटे छुटिया काम रे मु रही जाइतली आ सेडु फ्री हे कि वर्तमान जस्ट मु गाड़ी रे बसले आ संगे संग जॉइन कली डॉक्टर सुबुद्धि को बहुत बहुत धन्यवाद देबी जे आज मते गोटे मौका दैचंती गोटे एते सुंदर गोटे वेबिनार रे गोटे पार्ट मु आज हेई परची जदियो एई विषय रे कथा हबा पई मोर नॉलेज बिल्कुल नहीं डॉक्टर्स माने अछंती जो मान को मु सब बेले आम सोसाइटी रो माने सोसाइटी जदी आज भलो रे अछि जदी हमें समस्त सुस्थ अछु ताले सारो सबुडु बड़ श्रेय जाउची डॉक्टर्स मान को आ एटलीस्ट ए जो पैंडेमिक समय रे एई गत 6 मास 7 मास भितरे गोटे मेडिकल रो जो हेल्थ केयर डॉक्टर्स और मेडिकल स्टाफ्स मानकर केते आवश्यकता समाज पय अछि सेटा समस्त जानि सारचंती तो मु सेही भलिया किछि रियल हीरो मानक संगे आज कथा ही पड़छि आज से मानक संगे जॉइन कर पाछि सेटा मो पे बहुत सौभाग्यर कथा आ आज समस्ते आम ये एकाठी होइछे आपण माने समस्ते समस्त को एकाठी करिसंती तार कारण होची अवेयरनेस क्रिएट करबा पई ए जो डायबिटीज मधुमेह रोग आ ता जनित जो सृष्टि होतबा साइड इफेक्ट हिसाब रे जो आखिर जो समस्या सृष्टि हुए जो ब्लाइंडनेस किंबा विजन लॉस जो हुए ताकू केमिति आमे दूर करि परिबा काना मनुष्य जीवन रे जन्म सत मृत्यु सत आ जीवनटा भी सत किंतु एटा प्रत्येक मनुष्यर अधिकार जे से तार जीवन को सहजरे बंचिबा दरकार आ गोटे प्राकृतिक मृत्यु जाको कहा जाए गोटे कष्ट न होथुवा गोटे मृत्यु जोटा समस्त जीवन रे दिन ना दिन आसीबो तो सेही भलिया गोटे जिनस समस्त अधिकार आ सेही अधिकार को समस्त पाखरे पहुंचेबा पई हमकु जदि सबुठु बड़ अस्त्र हम पाखरे किछि अछि ताले सेटा होछि अवेयरनेस आमे जेते निजे निजे को अवेयर रखि परिबा आमे जेते निजे निजे को सचेतन रखि परिबा सेति कि आमे सेही सहज जीवन को आमे बंची परिबा से सहज सुस्थ जीवन को आमे बंची परिबा तो मु आपण मानक माध्यम रे एतिकी ही कहिबा पई चाहिबी जे आमे सबु माने आबाल वृद्ध बनिता समस्ते जो हेल्थ केयर रो जो सिस्टम अछि से सिस्टम को ठीक भाव रे उपयोग करबा दरकार आउ जदि आमे देखुचे जे हम घर पाखरे कोनोसी गोटे व्यक्ति अछन तांकर सेति के अवेयरनेस नाही ताले सेटा प्रथमे हमर कर्तव्य जे आमे से सचेतनतार वार्ताटा तांकर पाखरे पहुंचेबा दरकार आउ दरकार पड़ले तांकु नै कि कोनोसी डॉक्टर को पाखरे पहुंचेबा दरकार जदि तांकर पाखरे सेति सामर्थ्य नाही कि तांकर पाखरे सेति सुयोग नाही तो जदि आमे सेति के आम निजर आखि खोला रखिबा ताले हुए तो आउ कहार बंद हो जाउतो आखि को आमे ताकू खोली दे परिबा आ ता पई सारा जीवन पई आमे गोटे माने सुंदर जीवन आमे ताकू उपहार दे परिबा मु आ बेसी किछ कहबी नाही केवल आपण मानक समस्तिंकर गोटे सुस्थ जीवन कामना करिबी काना आपण माने जेते सुस्थ रहिबे आमे माने सेते सुस्थ रहिबो आपण माने होचन डॉक्टर्स माने आपण माने होचन हम समस्तिंकर सेकंड भगवान आ आपण हम मानक पई बहुत गोटे वरदान आपण माने समस्ते थैंक यू
बहुत बहुत धन्यवाद आपन जो मेसेज हम पाके पहुंचला and we thank you for your coming to this program and please stay for 5-10 minutes if you can आपन रहंतो 5-10 मिनिट रहंतो तापर आपन जदी टाइम पे जाई परिबे आ आपन आउथरे म अशेष धन्यवाद दोची आज रे प्रोग्राम रे पार्टिसिपेट करथिबारु आमे जिबा सर प्रोफेसर नारायण मिश्र सर आमे हम प्रोग्राम का मॉडरेट करबा आमे पैनल डिस्कशन करबा सबसे जो भी ऑप्शन किछ क्वेश्चन थिबो सर तो
सबे सचिव बाबू बहुत बढ़िया कथा कहिले हमर प्रधान जिंस हला जे ए हमर वर्ल्ड डायबिटिक डे जो आसुची तार पई आमे समस्त की वार्ता दबा आउ हमर ए जो आखिर गोटे रोग आपन कहले एटा को केमति आमे दुरेबा बहुत बढ़िया भाबरे आपन बुझेले बर्तन हमको एक्चुअली जन समाज को समस्त की हमको अवेयर करिया खबर बहुत बढ़िया मेसेज देले बहुत बहुत धन्यवाद आपन Bartaman, just we will discuss few things. Only this is for the audience. I will just ask few questions. Already it has been discussed, but it may be a repetition. But in the simple way, we can just give a message to the audience. So my first question will be, is this diabetic retinopathy is very common in India? And what is the dearth of problem in India? Can I just ask Dr. Ipade Jayant Rao is there, my friend, Dr. Jayant Rao? He's a very good friend of mine. Oh, if he's not there, I'll ask the president of our just Ophthalmological Association of Odisha, my friend again, my classmate and my friend, Dr. Gunashakar. Dr. Guna.
Yes.
Unmute karantu.
Yes, yes. Okay.
Okay.
The question is very good. Actually, after 5 to 10 years of diagnosis of diabetes, usually this retina is involved. So, due to the invention of insulin and other anti-diabetics, now the life is prolonged. So, any case of diabetes, they live a longer time.
Yeah,
so
is it common? Is it common in comparison to other countries? In comparison to other countries, is it common in India? And how many persons are actually suffering in India? from this disease? That is my.
Actually, I cannot tell the exact number, but I can tell you that the diabetic age of 10 years involve this retina, and about more than 20% of persons suffering from diabetes, they lead to this disease.
Yes,
Thank
sir.
you. Thank you.
Roughly
Thank you.
20% of all diabetics, they are prone to develop retinopathy.
Yes, Dr. Patnaik is a very good. Thank you for
Actually,
your answer.
One of the very important point, as alluded to by Sabyasachi sir, was that yes, you have to have the sugars under control, but despite that, the duration of diabetes itself is a very strong risk factor. So as the years progress, only controlling the sugars won't give you good reduction in this retinopathy. So years of diabetes again is a strong risk factor.
Yes, Dr. Kottar, just as you are continuing, I'll ask how we can prevent. You have already told, but how, just for in a simple message you just give, how we can prevent diabetic retinopathy, Dr. Kottar, because you are the most important person in the diabetologist. I can just ask you that how I mean, what should be the modality?
Yes, sir. The basic motto of this entire group led by Nageshwar sir and other dignitaries, Raju sir, is to basically prevent the occurrence of this complication. And very importantly, there are some non-modifiable, factors where we cannot intervene, is like the duration of diabetes. But yes, most of them are preventable. Like first of all, the ABC, what I've earlier said about. A means A1C, which is a reflection of your 3 months blood sugar control. So first is sugar control. Second is B, that stands for blood pressure control. C is for cholesterol control. And of course, avoidance of smoking is important. So it is irrespective of what drug you use, what is important is the good glycemic control and blood pressure and cholesterol control.
Thank you.
Dr. Sunil, if I can modify it a little bit in my way, it is A, B, C, D, E. A is for anemia, because anemia is also a major cause of progression of retinopathy in diabetics. Second, B is blood pressure. C is cholesterol. And D, what I have put is diabetes. And E is eye checkup. So A, B, C, D, E are the 5 points to prevent diabetic retinopathy. And this should be the message, I think. Yours is good, but I think I have included D and E into that, so that the eye examination also comes in the sequence of that 5 alphabets.
Yes, sir. Absolutely sounds holistic.
Thank you, Dr. Patnaik.
ମୁଁ ଗୋଟେ point କହିବି, ଯେହେତୁ endocrinologist ଅଛନ୍ତି, ସୁନିଲ କୋଟା ଅଛନ୍ତି, ମୁଁ କହିବି ଯେତେ ସବୁ diabetologists are there in the country, they should at least refer the patients once in the, at least when they check up the diabetes during the diabetes treatment, they should ensure that all the patients, they check their eyes. It's very important.
Yes, sir, this is very important. Today I have encountered a person having 15 years of diabetes, and I asked him, his diabetes is well controlled. He is regularly going to the endocrinologist for control. But I asked him, has ever your physician told you to go for eye checkup? He said no. So perhaps because of your busy schedule and busy practice and busy load of patients, perhaps this is one of the things which is being neglected. And I should, if the physicians and diabetologists can be little, make the people aware about eye checkup, then this will, there are also many, I have seen many endocrinologists who insist on that they say categorically, next time when you will come, you come with the report of fundus examination. That also we see. So there has to be a balance, and we can do this with little interest and motivation. We can do this.
That means each and every diabetic patient, irrespective of any, problem in the eye, whatsoever he is not facing the problem, he should go and have a checkup with the ophthalmologist. This should be the message. Those are in